I'm Tom Keller, President and CEO of Ozarks Medical Center. I am here today to address the communities that we at Ozarks Medical Center have the honor of serving. I, along with 3 expert physicians, will give you a glimpse into some of the activities and efforts underway at Ozarks Medical Center related to the current novel coronavirus pandemic. When there is a threat of an illness that could cause a surge of patients, coworkers at OMC step up to heighten our preparedness. We join hospitals around the state, and we work closely with the Centers for Disease Control, the Missouri State Department of Health, and local public health to coordinate response efforts. These are some of the measures OMC is currently taking throughout our facilities. We have heightened and increased the frequency of cleaning our public areas using only hospital-grade disinfectants. Our provider and clinical teams are receiving ongoing briefings and enhanced operating protocols. Extra shuttles are patrolling the parking lots to help get you safely to and from the entrance. The OMC pharmacy lobby is closed, but we have recently opened a drive-through window, which is the only location open for pharmacy services. Patients in the hospital can also have their medications delivered bedside before discharge. We are providing virtual visits to our at-risk patient populations and anyone seeking medical care that can be done virtually. We are working closely with our vendors and suppliers to ensure appropriate inventory levels of all clinical supplies and that they are used appropriately and emergency supplies are available. Our greatest resource available is our people. We have activated our incident command system to be ready if needed, and leadership is available around the clock to provide assistance and guidance as well as address any issues. Several OMC medical experts are currently providing leadership to Ozarks Medical Center. Dr. Kathuria, Dr. Saha, and Dr. Wallace. Dr. Kathuria is an OMC hospitalist board certified in internal medicine as well as completing a fellowship in infectious diseases. Dr. Saha is an OMC pulmonologist with board certifications in internal medicine, pulmonology, and critical care. Both bring multifaceted skill sets and experience in this particular area of medicine. Dr. Wallace is board certified in family medicine and serves as the medical director of OMC Hospitalists.
I am Dr. Samantha Wallace. I am a hospitalist at Ozarks Medical Center and medical director of our hospitalist group. OMC has been and will continue to closely monitor the ongoing situation and follow the guidance from CDC, the World Health Organization, Missouri Department of Health, the Howell County Health Department, and other community partners. As recommended by these organizations, there are certain restrictions we've implemented for patient and community safety, as well as some ways in which we are preparing our facilities to handle the sickest that this pandemic may affect. Additionally, many public facilities in our area have closed to support social distancing efforts in our community. Ozarks Medical Center has again implemented increased levels of visitor restrictions as of March 25th to continue to help reduce the possibility of spreading COVID-19 throughout the community. Ozarks Medical Center joins many other healthcare organizations, including Cox Health and Mercy, in proactively developing these restrictions as recommended by the CDC and Missouri Health Department. All patients and visitors are required to enter the hospital through a single entrance located through the door behind the emergency department. There are OMC coworkers there to greet you and help direct you, as well as assist with a shuttle ride or parking if needed. As of March 25th, OMC is only allowing visitors in the following areas. Number 1, visitors are allowed for active end-of-life care. Number 2, pediatric patients are allowed 1 parent or guardian. Number 3, labor and delivery patients can have 1 support person available. All other visitors in the areas of the hospital are not allowed.
My name is Dr. Ritu Kathuria. I'm one of the hospitalists and an infectious disease physician at Ozarks Medical Center. As many of you know, the virus was first detected in Wuhan City, China, and the virus is now spreading from person to person here in the US. Some viruses are highly contagious, while other viruses are less so. The coronavirus seems to be spreading easily all around us. The ways in which this virus is spread typically through droplets that can be transferred between people as a result of sneeze or cough. It is also thought that it is transferable from surfaces. While medical experts reference the need to flatten the curve, it is the idea that we as a society can slow the rate of infection for contagious diseases by taking measures like canceling schools, closing businesses, or sheltering in. The hope is to reduce the number of patients who need urgent medical care all at once. Organizations in our communities are assisting in these efforts by closing our local school districts, Missouri State University, West Plains Surgery Center. At OMC, we've closed our GI lab as well as canceling any surgeries outside of emergencies. We thank everyone in West Plains for these efforts. The virus will affect different patients in different ways. You may have already heard that about 80% of patients may experience mild to moderate symptoms. These symptoms may appear 2 to 14 days after exposure and include a fever of more than 100.4 degrees, cough, typically dry, and some shortness of breath. Those patients experiencing mild to moderate symptoms should self-quarantine for 14 days and treat their individual symptoms, just as they would for any other viral illness. The population most at risk are people over the age of 70 and are immunocompromised from certain medical conditions. About 14% may develop severe disease that requires hospitalization and oxygen support, and about 5% may be admitted to an intensive care unit. If you develop emergency warning signs for the coronavirus, get medical attention immediately. Emergency warning signs include trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, or bluish lips or face. For those more susceptible, namely our elderly and immune-compromised patients, more aggressive intervention may be necessary and in a hospital.
I'm Dr. Saha. I'm the pulmonary and critical care physician at Ozarks Medical Center. The best way to prevent the illness is to avoid being exposed to the virus by maintaining social distance of 6 feet and avoiding gathering of more than 10 people. We encourage everyone to be vigilant about hand washing with soap and water or the use of hand sanitizer. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched objects at your home and workplace. We have opened up a new viral ICU unit in the hospital, which is stocked and ready to go. We have providers there, and we have a plan of action on what we are going to do the moment we get our first case. We have acquired more supplies of ventilators, medications that we are going to use to treat for these people, not just the medication that we are using for the viral infection per se, but overall any medication that we might need. I think we are prepared. I think we got lucky that we are not hit first, and we are learning from our colleagues and other healthcare providers that are taking care of these sick people in different states, and I think we'll be at a better place when we have to deal with these patients. Please stay home except if you need to seek medical care. When you're around other people, wear a face mask, especially if you will be entering a healthcare provider's office. If you are not sick, please save the face mask for those who are. And of course, the continuing of frequent cleaning and disinfecting is crucial. I understand the need not to create panic, but we cannot hesitate to be stern in our warnings. If we look to what has happened in countries that did not hit early warnings, like Italy, we could end up on the same disastrous path. And that applies to the younger population as well. You're not immune. It is time for everyone to go home and stay home.
How we overcome this is through a unified community effort. We ask that you remain vigilant in your efforts in protecting yourself, your loved ones, and especially those most susceptible in our communities. OMC continues to operate to meet the needs of the communities we have the honor of serving. The events that have occurred in our community and around the world are unprecedented. And for many, it is a time of uncertainty. You can rely on us at OMC for the prudent advice and reassurance that will help you and your loved ones weather this storm. OMC is committed to keeping our patients, coworkers, and communities safe. Thank you for your continued support.